Social Health and Education Development Board, or SHED Board, is a non-government, non-political, non-profitable, faith-based and child-focused organization. SHED Board has been functioning as a service arm of Bangladesh Baptist Church Sangho BBCS, which is one of the largest and oldest Protestant Christian organizations in Bangladesh for socio-economic development and welfare activities since its inception in 1976. Since its foundation, SHED Board has been implementing various humanitarian and development programs in areas of health, education and economic development in different parts of Bangladesh. We work to address the needs of the most vulnerable regardless of race, color, caste or creed. Education is a universal human right, and SHED Board is fully committed to promote access to education to the most deprived children of Bangladesh. SHED Board has followed the Millennium Development Goals and is now involved to reach the proposed 2030 Sustainable Development Goals for education. SHED Board works to ensure inclusive and equitable quality education and promote lifelong learning opportunities for children regardless of gender, ethnicity, socio-economic background or religion. SHED Board's education program currently consists of preschool program, Daudpur, Parbatipur and Mundumala Shed Primary School, William Carey Memorial Mission High School, Baptist Mission Integrated School, Khunla and Rangamati Children's Village, Dinaspur Boys and Girls Hostel. Sanjay Haldar is from Gopalganj district. He grew up in a very poor family and his parents could not afford to keep him at school. In 1999, by the grace of God, he was admitted in the Baptist Children Village in Khulna. That time he was 8 years old. He studied there from grade 2 up to grade 10. After completing his studies, he left the school in 2007 for higher education. The Children's Village was supported by LMI Germany and administered by SHED Board Dhaka. Life at Baptist Children's Village was essential to build his personality and professionalism. From them, he has learned social and moral values in addition to the academic education. Nowadays, he finished his university degree and currently studying at postgraduate level. At the moment, he is studying in economics at Shohid Sohrawardi University. He is thankful to God for giving him the opportunity to stay at Children's Village and he is grateful to SHED Board also. He requested a prayer request for him that he may also serve the needy people of the country. SHED Board is committed to enable access to high quality medical care to the most deprived in Bangladesh. Currently, we are working in 4 different areas. First, Chandragona Christian Hospital, a general hospital that provides a wide range of basic essential medical, surgical, obstetric, pediatric and other clinical services. It is a 24/7 services to those living in Chittagong, Rangamati hill tracts and neighboring areas. Second, Christian Leprosy Center CLC. Now it is the only leprosy hospital for Greater Chittagong district including all 3 hill districts, covering a population of 26 million. It provides all essential care including food to leprosy patients free of cost. It also runs a rehabilitation center for the leprosy affected who have been abandoned by their family and villages. It is well equipped to provide all kinds of special care and treatments on leprosy related issues. Third, Nursing Training Institute. The Training Institute is officially recognized by Bangladesh Nursing Council and provides the essential qualification for medical professionals. With highly demanded qualification, former students are able to contribute to the improvement of healthcare in Bangladesh. And fourth, Community Health Program. Comprehensive Community Health Program under Christian Hospital Chandragona CHP started to be fully operational in January 2007 and it is providing a quality services to the people in 75 different villages. Josna Verma struggled a lot with her poverty in her childhood. She came from a very poor Christian family. By the grace of God, she had the opportunity to stay at Dinaspur Girls Hostel. That time she was 8 years old. This hostel supported by LMI Germany and operated by SHED Board Dhaka. She had a disciplined life there, which she liked very much. The hostel activities were very good. She liked the fellowship and the environment there. From there, she acquired the necessary academic skills as well as the moral and social values. She completed her school certification and then she got admitted at Christian Hospital Chandraguna Nursing Institute. Now she is about to finish her training and soon she will become a nurse. Here she has learned to live and work in a team. In future, she is looking for a higher study, especially in the field of nursing. She wants to serve the poor and needy people of the country. She wants to say thank you to Shedboard for their positive involvement in her life. Shedboard is committed to work towards building flexibility and social unity among disadvantaged communities in Bangladesh. This initiative is carried out by its social development program through three different approaches: Integrated Community Development Program (ICDP), Integrated Social Development Program (ISDP), Indigenous Women Empowerment Program (IWEP). These projects are covering an extensive geographical area of Bangladesh countryside based in 4 different localities. They are Kotalipara Upazila Sub-District under Gopalganj, Bhaluka Upazila Sub-District under Mymensingh, Pakichala in Bhaluka Upazila Sub-District under Mymensingh, Tanor Upazila Sub-District under Rajshahi. The work among indigenous women in Tanor Upazila is currently reaching people from different ethnic groups such as Santal, Malo, Mahali, Oran, Munda, Mahato, Pahan and Kormokar among others. Shilpi came from a very poor family. She is a member of Indigenous Women Empowerment Program (IWEP) in Rajshahi, which is operated by Shedboard. She took a loan from the project and bought a calf. She brought up the calf and sold it as a cow and made some profit from it. Then she took another loan and adding the profit from the cow's sale, she purchased a 3-wheel vehicle. It is now generating a stable income for her family. She also received training on environment, farming techniques and health education. She hopes and prays that Shedboard would be always with them and grateful to God for sending Shedboard to them. Bangladesh is constantly exposed to threat of hazards resulting from natural disasters. Emergency relief recovery and disaster risk reduction has become an important part of our yearly activities. In the middle of natural disasters, Shedboard always comes forward to stand beside the victims with relief that gives them hope and strength to overcome the disaster and build a better future. Our future goals are to expand existing projects and new initiatives in the areas of climate change and climate mitigation, food security, child labor and children's rights advocacy, community-based poverty reduction, women's rights advocacy, peacemaking and reconciliation initiatives.